minds. Diabetes. You hear the word, and maybe you feel a bit of concern, right? Well, today we're going to break it all down and show you how to move from that worry to a place of real control.
So let me ask you a question. What's something that affects millions, and I mean millions of people right here in our country, but it often works completely in secret? So silently, in fact, that most people have no idea they even have it.
You guessed it, we're talking about diabetes, or as many people call it, sugar disease. And yeah, it's a huge deal, because it's so good at hiding, just flying under the radar, sometimes for years. Okay, so let's dig into that first. Why exactly is this such a silent but serious health challenge? See, the real problem with diabetes, the hidden danger, is that it's a slow burn. When your blood sugar is consistently high, and you might not even know it, it's quietly causing damage. And we're talking about some of the most important parts of your body: your heart, your kidneys, your eyes, even your nerves. But, and this is a really big but, there's some seriously good news here. This isn't a life sentence. Diabetes can absolutely be controlled. And for many people, the most common type can even be prevented altogether. That's huge.
So to get to that point of control, we first need to understand what's actually going on inside the body. Let's get into understanding sugar disease.
Okay, first things first, let's talk about glucose. The simplest way to think about it, it's your body's fuel. It's the energy you get from food that powers, well, everything, from thinking to blinking to running.
But here's the thing. That fuel, that glucose, can't just get into your cells on its own. It needs a key to open the door. And that key, it's a hormone called insulin. Your pancreas makes it, and its whole job is to unlock your cells so the glucose can get in and do its thing.
So, in a perfect world, here's how it's supposed to work. Step 1, you eat something delicious. Step 2, your body breaks it down into glucose, which then travels around in your blood. Step 3, your pancreas goes, "Hey, there's sugar here," and releases some insulin. And step 4, that insulin key unlocks the cells, the glucose goes in, and you've got energy. It's a beautifully simple system when it's working right.
But what happens when the system breaks down? Well, in a normal body, that insulin key works every time, keeping your blood sugar levels just right. But with diabetes, it's like the key is either completely missing or it's bent and just won't open the lock anymore. And what happens then? All that glucose gets stuck outside, just piling up in your blood, and that's when your sugar levels start to climb. So how do you actually know if this is happening? Well, doctors have a very specific number they look for: 126. If you get a fasting blood sugar test and the result is 126 milligrams per deciliter or higher, that's the official diagnosis for diabetes. And you know, diabetes isn't just one single thing. There are actually 3 main types. You've got type 1, which usually shows up when people are young and they need insulin to manage it. Then there's type 2, that's the most common one by far, and it's heavily tied to our lifestyle, which also means it's often preventable. And finally, there's gestational diabetes, which can pop up during pregnancy.
Okay, so knowing all this brings us to a really important part: the risks and warning signs. And listen, we have to be straight about this. The risks are serious. Think about it. That extra sugar floating around in your blood, it's almost like a poison for your blood vessels. Over time, that damage can lead to some really scary stuff: heart attacks, strokes, losing your vision, kidney problems, and really painful nerve damage, especially in your feet.
There's a quote from one of our sources that just hits you right in the gut. It says, "Many discover they have diabetes only after these problems occur." Just think about that. People are finding out they have it because they're already having a major health crisis. That's why being proactive is so key.
But your body does try to send out some warning signs. You might notice you're running to the bathroom all the time, or you're just constantly thirsty or hungry. Maybe you feel wiped out, completely fatigued for no reason. Some people even lose weight without trying. And a big one is noticing that cuts or scrapes take forever to heal. But here's the most crucial point of this whole section. A lot of people have no early symptoms. None. Zilch. That's why you just can't wait until you feel sick. Getting a regular checkup, especially after you turn 30, is just so important.
Okay, let's shift gears now to the best part of this whole story, the empowering part. Because when it comes to type 2 diabetes, prevention is in your hands. And you might be thinking, oh no, this is going to be some huge, impossible lifestyle change. But get this, the science is amazing on this. Just look at this number, 5 to 7%. That's it. Research shows that losing just 5 to 7% of your body weight can slash your risk of getting diabetes. That's not a mountain to climb, it's a hill. It's totally doable. And how do you do it? With simple steps you can start today. We're talking about a brisk walk, 30 minutes, 5 days a week. Maybe cutting back on things like white rice and all those processed foods and packets. And for sure, ditching the sugary drinks. Instead, pile on the veggies and lentils. It's not about being perfect, it's about making small, smart choices consistently.
Okay, and finally, for everyone listening who already has a diagnosis, let's talk about what comes next. Let's talk about living well with diabetes. First things first, please don't be afraid. Getting diagnosed is not the end of the world. It's really not. With the right plan and the right care, you can live a completely normal, full life. It's 100% possible.
So what does that plan look like? Well, it's built on a few key pillars. First, diet and exercise. Those are your foundation. Then there's medication, whether it's pills like metformin or insulin, taking it just like your doctor says. And you have to be your own health advocate, right? That means regular testing to see how you're doing and getting those crucial annual checkups for your eyes, kidneys, and feet to catch any issues early.
You know, there's an old saying that just says it all perfectly. Health is wealth. And it's so true, isn't it? Taking care of your body, taking control of your health, it's the single most valuable thing you can ever do for yourself. Thanks for joining me.